And then obesity is a chronic disease, of course, that leads to very poor health. A body mass index of 30 or higher is classified as obese. More than 100 million people in the U.S. fit that class, and recent research shows obesity can have an even worse effect on your health than ever known before. Marty Salt explains.
42% of Americans are classified as obese, and this puts them at risk for developing deadly diseases like cancer.
There are a number of obesity-related cancers, which are 13 different kinds. These are cancers of the stomach, of the liver, the gallbladder, the pancreas, the colon and rectum, ovaries, uterus, even breast cancer.
Recent research from the Cleveland Clinic shows that instead of lifestyle modifications, longer-lasting permanent therapies could be the gateway to saving lives.
It seems like bariatric surgery can reduce that risk significantly.
Bariatric surgery has been shown to be the most effective way for obese people to lose weight. And in a study of 5,000 patients who underwent bariatric surgery, patients showed a 32% lower risk of developing cancer and a 48% lower risk of dying from cancer.
We found that for weight loss strategies, bariatric surgery is the most effective.
In battling obesity and saving lives, Marty Salt, WGEM News.
And most insurance companies will partially cover the amount for a bariatric surgery if the patient is in stage 3 of chronic obesity.